right, so I gotta pick a career. Let me see. This one seems good. I don't know about that one. Jeez, this is harder than I thought. Maybe this one. Uh, Jeez, this is harder than I thought. What to do? What to do? Maybe this one. No, that one. Oh my God, this is never gonna happen. If only someone could help me.
Say no more, my child. I'm Dr. Nuruzian, and I'm going to tell you about a very good career. It's called being a radiologist, such as myself. So, as a radiologist, you specialize in how to treat patients and diagnose them through the use of medical imaging techniques that include X-rays, computed tomography, CT scans, magnetic resonance imaging, MRI, nuclear medicine, positron emission tomography, PET, fusion imaging, and ultrasounds. What does a radiologist really do though? Like, what kind of stuff is involved in their field? Like, what are their tasks? So on a daily basis, a radiologist such as myself views medical results from radiology clinics and from that's done by my radiology technicians, where patients would go through medical imaging done or tests, and then I would correlate these results to the proper diagnoses. By interpreting these results, I could also then aid them to the proper medical care by radiation oncology, it's nuclear medicine, as well as minimally invasive procedures such as endovascular treatment of aneurysms and tumors, percutaneous biopsies, and pinpoint radiation therapy. Also, I direct the radiologic technologists, personnel who would operate the equipment, and how to properly perform the quality of these exams.
Note that the radiologist would recommend further appropriate examinations or treatments when necessary and confer with the referring physicians.
But what kind of education and training does a radiologist need? So, in order to become a radiologist, you must actually become a medical doctor first, which means you need an MD, a medical degree to become a doctor in medicine. However, before that, you need to successfully complete any undergraduate degree in university, which is usually about 4 years, to get into where I went, McMaster Medical School. Granted, you can do well in your medical college admission test, which is also known as the MCAT. Make sure you take radiology electives in your upper years at medical school. This is very important because after you completed your 4 years of medical school, you will need to pass a licensing exam before you apply for radiology internships programs as well as radiology residence programs. For residency, it's a minimum of 5 years of postgraduate education is required, including 1 preliminary year of training in clinical medicine, which is like internal medicine, general surgery, pediatrics, or a transitional year, and 4 years of training in diagnostic radiology. Therefore, the education is extensive and requires you to have completed a bachelor's degree, medical school, a residence, and passing a licensing exam. All right, you got me thinking now. So if I become a doctor and I become a radiologist, how much do they earn on average? What's the salary? Good question. Well, yes, you're right. A radiologist on average has an annual salary of approximately $200,000. This annual salary is heavily based upon the experience of each radiologist. Salaries of a radiologist can be upwards into the $300,000 range and can be as low as starting around a 6-figure salary.
Now on to the technology used by the radiologists. X-ray. A beam travels through the air, comes into contact with our body tissues, and produces an image on a metal film. X-rays are a form of electromagnetic radiation, as are radio waves, infrared radiation, visible light, ultraviolet radiation, and microwaves. They can be used for treating cancer due to the high energy electromagnetic radiation. CT scans. CT scan allows doctors to see inside your body. It uses a combination of X-rays and a computer to create pictures of your organs, bones, and other tissues. It shows more detail than a regular X-ray. MRI. MRI scans use powerful magnetic fields and radio frequency pulses to produce detailed pictures of organs, soft tissues, bone, and other internal body structures. A PET scan is a nuclear medicine imaging test that uses a form of radioactive sugar to create images of body function and metabolism.
Wow, who would have known the job of radiologist is so interesting? Thank you so much, Dr. Nuruzian, for explaining to me and taking the time really to tell me all about becoming a radiologist and what you do. I think it's clear to me the science path is something I might be interested in. Now I just gotta focus on getting my marks up. I think I'll start with physics.